I'm Mindy Buchanan with the Foundation for Sarcoidosis Research. If you're not familiar with the Foundation for Sarcoidosis Research, I'm going to shorten it to FSR because it's quite a mouthful to say. We are the leading organization based in the United States, but we do have outreach in the international space as well, particularly caring for patients and their caregivers with sarcoidosis. And if you don't know what sarcoidosis is, it is primarily affects the lungs. About 90% of our patients have lung involvement, but it can actually affect any organ, which makes it a really interesting disease to work on, and it's pretty rare. So FSR actually works in research. We have kind of two arms. We have sort of research and we have education and resources. And then on both sides of that, we work around awareness efforts. We've also donated about a little over $5 million in sarcoidosis specific research over the last 20 years. So that's a bit about our organization. And so what I'm going to talk to you guys about today is how FSR really leveraged some of our digital opportunities to focus in on wellness programming, particularly programming that really helps patients with their mental health and also other types of wellness, which include things like mindfulness and meditation. And so we kind of approach that because patients with sarcoidosis report high levels of depression and anxiety. I've just noted a couple of studies here, and that also leads to sort of a fatigue cycle. And so patients consistently struggle with this. We see this in pretty much every quality of life study that's been done in sarcoidosis. And then our patients also note sort of through our different surveys that we've put forward and different sort of evaluative measures we put after our different education programming, like our summit and so on, that patients are still pretty worried and have high levels of anxiety. There's a lot of confusion. That's pretty common for a rare disease because you have a trouble finding providers who understand the disease. And there's a significant amount of isolation and depression. Again, isolation is really related to being a rare disease, so patients have a hard time finding one another. And they consistently search for support, whether that's peer support or educational support, or even mental health support. So I'm focusing more on our mental health program. We do have an entire patient education arm that we do as well. But this is sort of what we did this last year and a half, especially during COVID, to help address some of the mental health issues that our patient population was having. So there's also additional access challenges. Again, there's a significant amount of access challenges to getting knowledgeable providers. But for this talk, there was a significant amount of shortages in mental health support. That's true in the United States. I think it is true also in sort of some international spaces where there's not enough mental health providers to serve the amount of people who actually need it. And particularly during COVID, there's a massive shortage. I mean, everybody is booked up for mental health services everywhere you go. It can take months to get into a clinician. So that's sort of the picture we have of our patient community and what they're dealing with right now. And they're dealing with this outside of COVID. All of this has been exacerbated through COVID. And so what we did was we looked at the kinds of programming we could deliver to our patients. And I think any org here who has been delivering patient direct support knows that there's not a one size fits all kind of support. So patients receive support in a variety of ways. And we can't just sort of deliver one item and sort of expect that that's going to cover for everybody. So we put together a 4-part meditation series, which trained people on how to meditate and what meditation was used for. So it's actually mindfulness and meditation. And that is actually led by one of our patient advocates who is also a nurse, and she's also a person with sarcoidosis. And so we really were able to introduce this presence of mindfulness and meditation. All of our series are available in our video library, but we also provide a once a month session after that 4-part series to focus on different things. You can see here we have a little ad there for our focus on pain management. We also introduced a 4-part Qigong series, again, because so many of our patients are dealing with lung sarcoidosis. Qigong includes a lot of breath work, and a lot of our patient providers, particularly our pulmonologists, were really behind us providing ways for patients to engage in other types of activities and movement activities that were gentle. And so it also was kind of fun to do something yoga. We think of yoga sort of immediately, but it was also kind of fun to introduce a new type of movement, gentle movement and breath exercise to our patient community. We also provide emotional and mental health wellness series. So this really came out of this sort of shortage of mental health providers and trying to create an access vein for patients. So once a month, we host a wellness series that's led by a clinical mental health provider, and they focus on different topics each month. You can see this one is understanding the grief process. Obviously, patients are dealing with a lot of grief for the loss of sort of their old lives and what they're able to do now. And then also a lot of people have lost a lot during COVID. And so we wanted to make sure our patients were feeling supported in that way. Other sessions include things like nutrition and empathetic and communication and understanding uncertainty, so how to manage uncertainty. And then finally, we provide these Sarc socials, and these really stemmed out of like the lack of support groups that were available to patients, especially during COVID. So in-person meeting is not something that people are doing. A lot of treatments for sarcoidosis include the kinds of medications that might put someone into an immunocompromised position. And so we put together these Sarc socials. They are hosted by our patient advocates, which are our volunteers who have been specially trained to provide support for other patients. And twice a month, they host these sort of virtual networking and community building events. And so and they're themed, some of them are themed. And all of these are meant to kind of provide an overarching sort of wellness sort of a la carte list, right? All of these events are free for patients and they can join as many as they want. But that was sort of our goal, was to how can we sort of promote mental health and well-being in our community. So how do we promote that to our community? We sent that out via email blast. So we have about 60,000 people in our email list. I will say this, we get quite a few international folks who join us. We do try to make it schedule these times for things that work from the international schedule as well. We put it out through social media. We put it out through peer sharing. So all of our patient advocates, we have 97 patient advocates who are volunteers. And then we have organizational partnerships, which also help promote these events. So some of the challenges that we saw in the last year, certainly Zoom fatigue was a huge challenge. And we tried to think about ways, particularly over the summer, how we could really address that. One, we do record all of our sessions with the exception of Sarc socials, because those are meant to be live networking, community building events. And then we did start adding in call-in access, and that's also for international numbers. And particularly, we've noticed that our mindfulness and meditation sessions are joined via call-in because we've started to promote it instead of sitting in front of a screen, and we're all sitting in front of screens all day long. Call in and go sit out and listen to the meditation, do the meditation and the mindfulness practice out in your garden or while you're taking a walk. And that actually increased the number of patients who are attending those sessions. And then we also, another reason we added the call-in access across the board was this sort of technology gap that we see in sort of lower socioeconomic groups who don't have access to really good Wi-Fi to watch the video and so on. So that call-in access has allowed patients to just call in and hear the information, which is really valuable to them. And all of our programming is done through Zoom, which can be done through a smart device as well. So by the numbers, I just wanted to give quite a quick overview. So this year in 2021, we've hosted 31 wellness webinars and socials with over 2,300 patients who have registered from our community. And again, sessions are recorded. Those who do register get additional materials like the slides that the expert used, if there are those, or any links that were discussed in the process. So lots of times our Sarc socials will discuss lots of different things, including links to different resources. And we provide sort of a quick rundown and list of all of those links. to anyone who registered. So we've had over 1,000 live attendees throughout those 31 webinars. And because they're now on our video library, we've had over 3,500 views of all of those webinars so far this year. And then, I just included some quotes. So the reception for this programming has been massively positive. Patients have really taken to, especially our mindfulness and meditation sessions. We're seeing consistent uptick in the number of patients attending every session. And we see people going back. We're asking patients, like, how often are you watching those? We see patients consistently rewatching or re-listening to those meditation sessions. So it's like we've put together our own Calm app, if anyone's familiar with the Calm app, through our video library. And so, we really don't know what COVID is going to continue to bring. I don't know. In the United States, we consistently have sort of intermittent lockdowns or intermittent, like, don't go out, and our patients are vulnerable in that way. And so we will continue to provide these sort of virtual options for folks as part of our sort of consistent patient programming. It also allows us to reach patients who are in more rural areas. And honestly, if you're looking at sort of the financial cost, the return on investment here, it would cost us a heck of a lot more to be delivering these kinds of programming in person. And I don't even think it would be doable. And so if you're looking at the reach and the sort of positive outcomes that are coming from these, and at the end of the year, we are planning to do a full survey for anyone who's attended even one event with us, to better understand. We do individual surveys at the end of every session, but we will be doing a larger, sort of more comprehensive survey to better understand, like, how we move forward and what people want to see in the following year. But that's it. I was trying to be quick to get us through. I know everybody wants a break. And so I've also included, and I can send these out, our video playlist, which anybody can watch and check out any of the videos that we have.